which is known as ergograph. Okay, so by this we'll be knowing our skeletal muscle work done. Okay, so it is known as Mosso's ergography. So in the introduction, firstly it was discovered by Mossos, so the name came from there. After that it was known as Mosso's ergography. So this is what it does mainly is, this is a recording of the voluntary contraction of the skeletal muscles of the human being on a moving kymograph. So here we have one paper. So there will be, the graph will be seen there. So this Mosso's ergography is done to assess the performance of the flexors of our hand. Okay, so we know the flexors and the extensors of our hand. Okay, so this is for the flexors of the fingers. It is performed to study the performance of fatigue in human skeletal muscles. So what is fatigue? Can anyone say? Tiredness. So how does it happen? What happens? What will happen to that particular muscle? Any form of exercise, any form of stress. Okay, so physically as well as mentally. Okay, it can lead to fatigue. So suppose you are when for men and for women there are normal calorie intake, na? So if you are not consuming as much of calories as per required, so if your work is more than that of the calorie intake, so you will get fatigue. Okay, so what are the things can lead to fatigue? Mainly what supplies us energy? Yes, so carbohydrates are the source of energy. So in carbohydrates, which one? Mainly glucose. Okay, so how much calorie does 1 gram of glucose supplies?
4.1.
Yes, around 4. Okay, so the carbohydrates are the major form. After that breaks in the form of ATP, we get the energy, na? So everybody knows this. What are the factors that affects the performance, okay, during fatigue? Like in certain age groups, like in young adults, they will perform better than the children and the elderly peoples. In genders, men perform better comparatively in comparison with the females. And the height, taller people can perform much more better. Physical build, if the person is sound physically built, he can perform better than the obese or than the thin person. In case of training, well-trained individual can perform better than that of untrained person. In certain races also we can see, like in Europeans, they can also perform better than the Asians. So motivation is also a factor in affecting the performance. So it acts as an stimulation and a reward system in the brain, which increases our performance. Okay. So mainly when we suppose a person after a strenuous exercise, so if we divide the forms of exercises, like there are isometric exercises, there are isotonic exercises. You know, na? What are the isotonic exercises? And what are the isometric exercises? Can anyone? So this Mosso's ergography, what is this? What type of exercise is this? So first we have to know what is isometric and what is isotonic. So isotonic is the muscle contracts and relaxation takes place. Okay, those types of exercises. Name some exercise. Okay, bicep curls, then. Okay, then. Deadlift. Okay, and name some isometric. What is isometric?
There's a
where there is constant tension on the muscle, on those types of exercises. What are those exercises? Is this isometric? The tension will be constant here. Planks, yes. Who said planks? Planks, planks is a type of isometric. Here the tension is constant. In isotonic there is relaxation and contraction of the muscles. In isometric there is constant tension on the muscles. Okay. There is one form of squat, that is we do by pressure, giving pressure on the wall. Have you seen?
Head squats. Head squats.
Head squats.
Head squats.
Okay. That is we push our hip with the wall, and then we at least stay to at least 1 minute. Okay. There is a type of isometric exercise. For the lower limbs, this is one, and for the upper limbs, one constant pressure in the walls. Okay. If we press it, okay, that is also a form of isometric. So one thing, in which exercise the fatigue will be more. So first we have to know how does that isotonic and isometric works. Okay. So in isometric, how does it works? If there is constant pressure, how are the nutrients supplied to the muscles and the tissues? How are those supplied? For that working of that muscle and to generate energy, it needs nutrients, na? How those will be supplied? So blood is the thing. Blood supply, it will supply. Okay, there is arterial supply, there is venous supply. Na? The blood, the arteries will supply. What are the things it will supply? As I said, na, that main source of energy is mainly glucose. Then electrolytes is also there, na? Electrolytes, then oxygen, yes. You are missing oxygen. Without oxygen, can it perform? It won't perform. Then anything you want to add? Okay, mainly this. Okay. So after the arterial supply, when we are having the exercise going on, whether that is isometric or isotonic, okay, then what will happen there? At the cellular level, there will be formation of metabolites, oxidation, there will be going on. Then what will happen? What are the metabolites which will be present after the exercise going on there and the reactions, various reactions? Yes, lactic acid. Then, so in this experiment, here we will be raising the with the help of the sphygmomanometer, we will be raising the pressure to a certain level, like to occlude the venous flow and to the arterial flow also. Then we will be checking, okay, that time how the fatigue and where is the fatigue more, in the arterial supply or in the venous supply. So in there, when the blood flow will be obstructed, so there will be loss of blood supply or there will be less flow. Okay, so here there you will be having sensation of pain in your hands. Okay, so why we are having sensation will be on the hands? This is due to supply. This is known as ischemia. Okay, ischemia. So that time we will be having pain. Here one thing is released, that is known as Lewis P factor. Okay, Lewis P factor. So here mainly three components are there. One is, as you said, lactate, another is adenine, and one more is potassium. Okay, three factors are there mainly. Okay, so this will be coming here. Okay, when the experiment will be going on, we will be showing you. So the venous when the venous flow is also necessary, because if the metabolites are present there, it will also affect in the efficiency and the performance of the exercise. Okay. So factors which affect the fatigue. So degree of work and the duration of work. So here the weight to be lifted. So the weight, if the weight is more, there will be early fatigue. Okay. Then frequency of contraction. If the frequency of contraction is more, the fatigue also increases. Okay. If the motivation is, if you are motivating the person who is doing the exercise, there will be fatigue will be delayed. Okay. And in case of blood supply, the venous and arterial occlusion, as I said, it also affects the fatigue. So the factors that cause muscle fatigue, and the nutrients like oxygen and creatine, sulfate, ATPs, and certain neurotransmitters. Okay. What are the neurotransmitters? Then and noradrenaline, adrenaline, serotonin. Okay. And accumulation of the metabolites. Okay. These are the factors that cause muscle fatigue. Okay. So one thing is motivation. So can anybody say how will motivation affect? Suppose your muscle is fatigued. Okay. Due to like strenuous exercise and occlusion of the blood flow. So suppose in this experiment we will be mainly using our middle finger. Okay, the flexors of the middle finger will be using here for the testing. Okay, so how will you say this muscle is fatigued totally? Complete fatigue. Huh?
Zero movement, not taken.
Okay, zero movement is done. So after that you said what you said about motivation. So his name was Dixit. So you said go Dixit go. Okay. So after that again 2 repetitions he was able to take. So how did it affect? So this is not complete fatigue, na? So how will you say it is complete fatigue? If he can't, na? If you are saying go Dixit go, so even after that also if he can't being able to move his fingers, here we don't see any contraction in the ergograph. So that time you'll be saying that there is complete fatigue. So a complete fatigue from where it starts? It has to start, the starting point is the muscle, then the neuromuscular junction till the central nervous system. Okay, motivation acts in the CNS, na? CNS. So at that time it will be completely fatigued. Okay. So what is the principle here? The subject contracts his flexors of the fingers against resistance using Mosso's ergogram till the finger is fatigued. Work done is calculated to study the effect of various factors on the performance. So here we will calculate the work done. So what are the apparatus here? Requirements. So the apparatus used to record an ergogram. There is an arrangement for fixing the fingers and forearm in the appropriate holders. A cord is passed over the pulley carrying load of 3 kgs. At one end is attached to the sliding plate. The sliding plate is connected through the sling to the finger, the flexor of the flexors of which are being studied. Okay, so here the flexors will be studying. The metal plates also carry writing pencil or pen which writes on the paper. So here the graph will be formed. We will show you the picture. When the middle finger is flexed, the load is lifted and the distance through which the load is lifted is marked by the writing lever or the paper. Okay, so I will show you. So this is the picture. Yeah, you can say this one. Okay. So not this one. This is a bit changed. The previously it was there. Okay. So our forearm will be fixing. So our forearm will be fixing here. Okay. Here our forearm will be fixed with this cuff. Okay, we have this cuff here. Our forearms will be fixed here. Then our index and the ring finger will be putting inside those tubes. Okay, for fixing. This is for fixing. Okay, and then with this loop of thread okay, which is passed. This is a lever system, okay, and this is the pulley, this is the loop, and this is the weight, okay. So how it works is, so here we have put a pencil here and a paper is being put here. So here this is known as kymograph, okay. So here we take the repetitions. So suppose for 1 minute with the help of that, sir told na, what was that online thing? Metronome, okay. So with that we will be setting the timer. So suppose for every 2 seconds we will be taking one contraction, okay. So how much in 1 minute? In 30, yes. So you have to do 30 contractions in 1 minute. So after fixing here and fixing the fingers here with the help of the loop in the middle finger, okay, like this. So we will be pulling like this, okay. Suppose in 1 second, 2 seconds we will be taking one, na? So can you put the timer? So like this, okay. 2 in 1 in 2 seconds, na? 30 में fix करो, okay, like this, okay. So it will form a graph, okay, here. So in 1 minute how much you can do, okay. So here we have 2 plates. So one is 500 and one is 500 grams. So how much weight is here? 1 kg. So in with this weight we will be taking the readings, okay, for 1 minute how much you can perform, okay. So this is from the view from the above, okay. This is the pencil, okay. There are screws. With the use of these screws you can adjust the pencil, okay. You can tighten it, okay. So about the metronome, okay. So we are not having that metronome here, so that is why we are using the online one, okay. So this is the instrument used in the experiment requiring an interrupter adjuster from 40 to 200 contacts per minute. The frequency of interruptions is adjusted by sliding the clip on the sideways movable metal plate in front of a graduated scale. The position of the clip on the scale goes the frequency at which the sound is delivered. So with the sound you will be pulling it, okay, every 2 seconds, okay. So here we will be making like a box. So at first without any obstruction, okay. Normally how much you can perform, then venous obstruction, then arterial obstruction with the same weight, okay. We will be doing it like this, okay. So as I told, with the help of the sphygmomanometer and a set of 500 gram weight, so we have taken that. And for the procedure you have to instruct the subject how what we'll be doing here and what we are finding here, okay. So here the index and the ring finger, as I said, of the subject is to be inserted into the fixed tube holders. So these are the fixed tube holders, okay. Here we will be inserting the fingers, okay, and with the help of the middle finger we will be pulling the load. So why we are using the middle finger here, not the other fingers? So middle finger, this is the strongest, okay, strongest, and the longest also. That is why we are taking it, okay. So with this you can test your power, okay. So then we set the metronome to oscillate at once in 2 seconds. So it is 30 contractions per minute, okay. Then connect the sling to the middle finger, ask the subject to lift the load by maximal. Anything you want to say? Okay. So after that, maximum contractions of the flexors of the middle fingers, and then repeat the lifting the load every 2 seconds along with the metronome oscillations. asks the subject to continue lifting the weight till the load can no longer be lifted. So he has to continue till the load is not being able to lift. Okay. So after that we will rest him for 15 minutes. After taking the rest, he will be repeating the procedure. Okay, till the subject is fatigued. So here first we will be testing the as I said, normally we will be taking the readings, okay, without any obstruction. Then we will be obstructing the venous flow at 40 milligram 40 mm Hg, okay, mercury, and then he will be taking suppose for 1 minute or 2 minutes till he gets fatigued. Okay, then we'll keep him rest for 15 minutes. Then we will go again for the arterial. Okay, that is around 150. Okay, so here it is written 200, so it is 100 mm Hg. So during arterial occlusion, both the venous and the arteries both will be occluded, na? Or only the arterial? Both. Okay. So this is the thing, and then we'll calculate the work done. Okay, so then we'll be going for work done. So these are the precautions. The subject must be instructed properly, maximum effort, to give his maximum effort. Then the subject should be move his fingers according to the oscillation set on the metronome. Then subject should be continuing to do the work till he is unable to lift. Then 15 minutes rest, as I said. Okay, this I have already said. Okay, so this is the calculation part. Okay, so how will you calculate the work done? Force into total distance. Okay, so the work done will be in kgs. The F will is the load. Okay, then the distance covered will be in meters. To get the total distance moved, measure the total length of the vertical lines, that is adding all the vertical heights. Then the D, the total distance, is the number of contractions into average height of the contractions, that will be in centimeters. Okay, that is the A. Okay, so for average height of contractions, okay, here are two things. Okay, so in the book it is given nicely. Those who are having the EKG, okay, the last page you open in the Ergograph. You have opened na that graph. One is graph is there na. So first, how will it be looking? Everybody have opened it. Found it na. See the shape of the graph. How does it occurs during an non-occlusion and in occlusion of venous and arterial? How does it looks na? So there is a division na, A and B. There is a division of A and B. The A is the rectangular box and the B is the triangular na. So here that is the thing. Here the area of the triangle we have to find it. Okay, how much it is. Then the formula will be half into base into height for the area of the triangle, and for the area of the rectangle, that one, the first one, that is the A, it is length into breadth. Okay, and by total length of the base, which will be in centimeters. Okay, so here from here we will be finding out the A, then the A will be putting in the D. Okay, that is the number of contraction, then average height of contractions in A. Okay, everyone is understanding me? Getting na? So from here we will be finding the D here, and then we will be putting the D in the work done, that is force into distance covered. Okay, so here are some graphs. Okay, effect normally how it looks in venous occlusion, in arterial occlusion, how does it looks. Okay, in motivation we said na, in motivation it also helps in the work done. Okay, and in venous occlusion, in arterial occlusion, what is the main difference here? When does the fatigue occurs? faster?
Atrial.
Atrial, and why?
Sensory muscles.
And nutrients, and what are the things? So both are actually needed here for proper functioning of the muscle. Okay, as I told na, for the arteries what they does, and for what the venous supply does, the metabolites which are formed, they returned it, and the carbon dioxide also which is formed, that is also it is excreted. Okay, so this, okay, so this much for this class. Okay.